welcome. My name is Lars Lindberg, and I work at the Nordic Welfare Centre, and we'll have a few words. So, this conference is a joint conference together with the Nordic Network for age-friendly cities and municipalities, Nordic Welfare Centre, and the World Health Organization. Yongjie will from here will talk a little bit more about the global network. First, a few words about the Nordic Welfare Centre, which is an institution under the Nordic Council of Ministers, and we have an office both in Stockholm and Helsinki with about 24 employees. And okay. A general description is our mission is to we work very much with different kind of projects on development of welfare, experience and knowledge sharing, best practice and so on. And many of our target groups are politicians, researchers, civil societies, people who work in the different kind of activities around the global, in the Nordic countries, in disability issues, public health. We have work, for instance, with the deaf-blind issues also. And this part, age-friendly, is next one. This part, what we are now coordinating the Nordic network for age-friendly cities and municipalities, which is based on a mandate from the Nordic Council of Ministers. And the network have many different meetings. They have been mostly digital. At the moment, I work with the issues now at the Nordic Welfare Centre, but from next year, it will be Louise Kjell Thomasen. Maybe you can raise your hands. She will work with and be responsible for the issues in the future. So please, the opportunity to talk with her during the breaks and the nests and so on. We have also a lot of publications, and both within the Asian in general and indicators and so on. And you find all of this on our project website we have. You find it here.
I'm Anne Berit Rafoss. I work for the Norwegian Directorate of Health, the Centre for an Age-Friendly Norway. I've had the privilege of working on the age-friendly agenda now for 10 years. Very passionate about this approach to an aging population, and it's wonderful to see both a mix of new and old faces here. So I've been given the honourable task to being your moderator for these 2 days. So I'll try to manage the time, presentations and questions as best as I can. First off, we'll have a video message from Kira Fortune, Regional Advisor, WHO, Healthy Cities, Health Promotion and Wellbeing.
Dear colleagues, it is my utmost privilege to welcome you all to the UN City, the home of the WHO Regional Office for Europe. My name is Kira Fortune, and I'm the Regional Advisor, Healthy Cities, Health Promotion and Wellbeing. It is such a pleasure to have this opportunity and to be speaking to such a passionate group of colleagues attending the Nordic Network for Age-Friendly Cities and Municipalities Conference. This gathering really represents an important moment in our ongoing quest to create better and more age-friendly communities. The WHO European region boasts one of the world's highest proportions of older adults. This is a testament to our societal progress and maturity, and therefore we need to ensure that this journey is one filled with opportunities and support. Our experiences of aging are significantly shaped by our physical, social, and economic environments. And these environments can and should be tailored to help us achieve our aspirations regardless of our age. The Healthy Cities movement started as a way to bring the WHO Ottawa Charter on Health Promotion from 1986 into the streets of the people. Back then, the notion that health is created and lived by people within the settings of their everyday life where they learn, work, play, and love was a groundbreaking idea. Our network believes that cities and communities play a pivotal role as hubs where we can tap into the immense potential of an aging population. They are where we can address the critical gaps in health and care provisions, creating a more inclusive and age-friendly environment for all. Now, with the demographic shift towards an older population, cities must adapt to meet the evolving needs of older adults. Therefore, strengthening the agenda for healthy aging and age-friendly environments at both city and national levels become imperative. Now, in this context, I'd like to acknowledge the valuable work carried out by the Healthy Aging Task Force, which is the network's most active and engaging task force. The members have contributed to our understanding of how cities can effectively respond to the needs of older adults. I'm of course aware that many of you are actively engaged in both the Healthy Cities and age-friendly networks. These collaborations are invaluable, and now more than ever, we must join forces to work together towards a shared goal. I'm excited to announce that the Healthy Aging Task Force, a cornerstone program within the WHO Europe Healthy Cities Network, will be commemorating its 20th anniversary in 2024. This really represents a significant milestone in our collective journey, reflecting the progress that we have made. The synergy between the Healthy Cities Network and the WHO network of age-friendly cities and communities is absolutely vital in advancing the cause of healthy aging. It is in fact through this collaboration that we can truly make a positive impact in our societies. Now, as we gather here today, we eagerly anticipate strengthening our endeavors in the field of aging and providing a platform for further discussion and collaboration at the upcoming Healthy Cities Network's annual conference in Utrecht in the Netherlands that will take place from the 21st to the 23rd of November. Now, this is an opportunity for us to build on the knowledge and experiences shared here and continue to work towards a more age-friendly future. Through the creation of age-friendly physical and social environments, we empower older adults to age in surroundings suited to their preferences. And this, of course, enables them to continue their personal development, foster inclusion, and also contribute to their communities, all whilst maintaining their independence and well-being. These are the building blocks of a more vibrant and inclusive society for all generations. Let us continue to work together to build a future where healthy aging is not only a goal, but a reality for all. Thank you again for allowing me to join your meeting virtually. I, of course, hope that next time this will be in person, where I get to meet all of the real change makers. Have a very productive session ahead at the UN City. And with that, I thank you.
It's now my pleasure to introduce Yongjie, Technical Officer, WHO Europe, who will talk about the UN Decade of Healthy Aging and the WHO Global Network of Age-Friendly Cities and Communities. The floor is yours.
Hello, everybody. Thank you so much for coming and for joining us today. My name is Yongjie. I am a technical officer for aging and health at the WHO Regional Office for Europe. We are the biggest region for WHO with 53 countries that we're supporting, from the Atlantic Oceans to the Pacific Oceans. And so very pleased to also be joined by our wonderful colleague, Dr. Alana Officer from WHO headquarters, and also my dear colleague, Dr. Manfred Huber, who recently retires, and I have a big shoe to fill to take over the aging program. And in many ways, age-friendly environments really started with Manfred here, and so it's really great that you're joining us today, dear Manfred. But also to welcome you to the UN cities where the regional office sit. And this is a very special year for us. This is the 10th anniversary of this building. And this, prior to this building, there are multiple UN agencies working across Denmark. And so the Danish government have the foresight of bringing us all together to work together for our member states. And so thank you so much for the Danish government. I know we have representatives from the ministries of health, the Danish health authorities. So thank you so much for this gift. And to you, welcome home. This is the gift, a wonderful gift from Denmark to all of us. So today in our, well, that's me. So today in our European regions of 53 member states, we have the highest share of older populations. And we will see this over the next few decades, particularly for the oldest old populations of 80 plus. Next year, if you want to take pictures, next year is a very significant year for our region, 2024, because next year, we will see this historic shift where there will be more older persons living in Europe than younger persons. And of course, aging is a universal journey and one that touches us, all of us. If we're lucky, we become an older person. And so through the UN Decade of Healthy Aging, we are really creating an environment for all ages, for all of us. So just a raise of hand, have anybody heard of the UN Decade of Healthy Aging? Oh, great. This is great. So we are like-minded here that we can use the Decade of Healthy Aging to come together, to work together for all of us, because it's not just for older persons, but creating an environment for all of us to age together. So you may have seen this video that was produced last year. On the UN Decade of Healthy Aging and to identify 4 action areas. And so I'd like to share this video to you again. So here's the video.
When it comes to aging, we can learn a lot from nature. Consider a tree. As it grows, its rings expand outwards, telling the years gone by. But those rings tell more than just time. If you look between the lines, you will also see how the tree's habitat and living conditions have impacted its life. The healthier the ecosystem, the more it will have thrived. We humans are no different. As we age, our physical and social environment provide us with vital resources. Access to healthcare and proper nutrition, opportunities in education and employment, safe housing and supportive communities become the roots that nourish our development and well-being. So what happens when we grow older if our environment does not sustain us? Just like a tree, our health declines and we struggle to flourish. Over time, we may become disconnected and a burden to others. The UN Decade of Healthy Aging aims to give everyone the opportunity to add life to years, wherever they may live. A transformative collaboration of diverse sectors and organizations, the decade focuses on changing how we think, feel and act towards aging, cultivating age-friendly environments, creating responsive healthcare systems and services, and promoting long-term care and support essential to living with meaning and dignity. By adding quality to quantity, we give all people the chance to lead a meaningful life, no matter their age. And that includes you, and you, and you, and me. Together, we can make every year count, not by the numbers, but how we live and grow in between.
That's a really good goal, is that we don't simply just want to add years to life, but life to years. And so the decade brings together governments, civil societies, international agencies, professionals from all different fields and sectors to media. Extremely important that we work with the media to change the way we talk about age and aging, the private sectors for 10 years of concerted actions to improve the lives of older people, their families, and the communities. So you can scan the QR code where you have access to all of the materials for the UN Decade of Healthy Aging, including the videos, as well as you'll see at the back that there are some pamphlets about what the Decade of Healthy Aging does, and all of the materials on each of the 4 main action areas. So I like to speak about some of the WHO resources on the Decade of Healthy Aging that would be of relevance to you working in the cities and to promote healthy aging. So the vision of healthy aging will not turn into a reality unless we work together and we work on it. Ageism is an insidious barrier that is woven into the fabric of our society, and it undermines our collective potentials. And so ageism is a barrier, but it's not an insurmountable one. And ageism is defined as the way we think, feel, and act on aging. And shockingly, 1 in 2 people hold ageist view and belief towards an older person. And there's profound consequences to our physical health, mental well-being, as well as the social health. And moreover, ageism also exerts a significant economic burden on individuals and on the society at large. So that is why the first action areas of the Decade of Healthy Aging is to address ageism, is to change the way we talk about aging, to change the way we think, feel, and act on aging. And so here is the QR code where we have the global report on ageism that was released a little over a year ago, and which summarizes the best available evidence on ageism. But it also outlines 3 strategies of what we can do together and 3 recommendations of how we can come together to combat against ageism. Fortunately, ageism can be combated. And so the first is through policies and law. And the policy and law to protect the rights of people by addressing age discriminations. Second, through education activities where we can transmit knowledge and skills by changing the way we talk about aging. And finally, to bring people together across generations to promote a better understanding. And so this report recommends 3 action areas. Of course, first is to address those 3 strategies, but to also improve data and research so that when we track over time, we are based on evidence. And the third recommendation is that we have to build a movement to change the way we talk about age and aging. So how do we do that? How do we change this narrative? And it's actually quite simple. It's a very subtle things that we can do by using the way we talk, the language that we use. It's extremely important and it has a huge impact. For instance, the words that we use in describing people can make a person feel respected and seen. So at least in the English language, we use the word older persons or older adults rather than elderly. And likewise, we should also avoid languages that isolate older persons from the broader community. So concept or metaphors like the silver tsunami, the ticking time bomb, should definitely be avoided. And as much as possible to include older persons in our communities for them to share their diverse experience. So you can find all of the WHO resources on how to combat against ageism, how to change the narrative on age and aging in this QR code. And this is really promoting across different generations because, of course, ageism works both ways. And so you will have access to all the social media tiles, the videos, the toolkits, and conversations about how to talk about aging and ageism. So just a few weeks ago, and Alana is leading this very important work, is that we just released this new publication. I mentioned earlier, one of the 3 strategies is intergeneration contact. It's a proven strategy to bring generations together to address ageism. And so this offers a clear step-by-step instructions for anyone interested to use intergeneration practice to combat against ageism, to foster understanding and mutual respect across generations. And these guides draw from existing research, from grassroots communities, to also examples from networks like the Global Network of Age-Friendly Cities and Communities. It is extremely important as we gather here to talk about what community can do, and I think this is a way in which we can bring different generations together. Ageism and abuse of older people are closely linked. In fact, many experts often thought of abuse of older persons as an extreme form of ageism. And abuse of older people take many different forms, and it could include physical abuse, psychological abuse, sexual abuse, financial abuse, and neglect, and many other forms of abuse. And it also affects a staggering number of people. 1 in 6 older persons experience abuse in the past year. And that's amount to 141 million older people. But abuse also occurs not just in the community. Abuse can also occur in institutional settings like nursing home, long-term cares, and other facilities, where 2 in 3 staff admitted to abusing older persons. So beyond these stark statistics of 1 in 6, 2 in 3, it is very important that we really remember the human faces, the numbers behind the faces. The faces behind the numbers. And I'd like to share a very short video clip from the courtesy from the Australian Human Rights Commissions, which really features the survivors of abuse grappling with the devastating impact of abuse. And it really is a call to action for us to address them in our communities.
He said I'm a burden.
And I made their life miserable. If I don't change my will, I can't see the grandkids again.
And he's my son.
It just breaks my heart. I've got no idea what I've done wrong.
You know, to hear voices like this and to know that abuse of older persons can be combated really is a call for us to take action, particularly in the communities where we can address some of the risk and protective factors. And so our focus is to empower older people and empower the survivors. And we call it survivors rather than victims of abuse and neglect because they are resilient to share their stories, to bring it out of the shadows into the mainstream. And through the Decade of Healthy Aging, we are stepping up, working together across UN agencies and with academic institutions to identify action areas of what we can do together. And so we identify 5 action areas. First is to combat against ageism. Second is to generate better, more accurate data, which I'll speak about later, where we are gathering information on the prevalence of abuse, the risks and protective factors, the consequences, and interventions on what work. To scale up on these interventions, effective interventions, so we can apply them at the local and at the national level, and to establish investment case and to raise resource on that. And so all of this is published last year on June 15, which is World Elder Abuse Awareness Day. So you can find out about what we can do and what you can do to address abuse and neglect of older persons by scanning the QR code. Mental health is integral to promoting health and well-being of older persons. And so this is Zadina Serovic from Bosnia and Herzegovina. Last year, Dr. Tedros, our General Director of WHO, announced 50 global leaders who have transformed our world to become a better place to grow older. Of the 50 leaders, 11 are from our region. And do you know why she's one of the 50 leaders? Have you seen her videos? No? So she was identified as a leader because of her story. She retired at the age of 70, and she felt very depressed, and she felt the loss of her role in the society. But she soon found using art as a way to overcome depression. And because of that, she started a whole movement of older women using art as a way to address mental health issues and to address social isolations and loneliness. And I know you're talking about art here. And so I think this is another way in which our community can think about working together with older persons on utilizing their knowledge and skills and to build a whole communities. So we have a short video of Zadina and her story. So.
Rođena sam prije 70 i skoro 2 godine. Sasvim je slučajno bilo da sam uzela peglu i voštanu boju. U stvari, od momenta od kad sam ja napravila tu svoju prvu sliku, ja sam bila svjesna toga da je to potpuno jedan novi način da se ja izrazim. Danas sam, mogu komotno reći, slikarica, enkaustičarka. Svuda sam radila radionice. Polaznici su najčešće bile žene i veoma često su to bile starije osobe. Umjetnost apsolutno pomaže svima kad je u pitanju i anksioznost i depresija. Ja znam zato što sam to prošla. Umjetnost pomaže upravo kod tih nekih teškoća, kad stari ljudi ostaju sami, usamljeni su, nemaju društva. Mi kroz umjetnost unosimo radost u njihov život. Unosimo boje u njihov život. Znači, živim punim plućima, živim za umjetnost i živim zato da svima pokažem da je umjetnošću moguće prevazići probleme.
So in this spirit, WHO Europe has established a pan-European mental health coalition with Her Majesty Queen Matilda of the Belgians as the patrons. And this coalition is a partnership with countries, with experts and civil societies that come together to address the mental health across our regions. And mental health of older persons is one of the 6 priorities. And through this coalitions, we are finishing a mapping review looking at services and gaps to provide mental health support for older persons, and that will be released at the end of this year. Social connections is extremely important. I'm not going to speak too much about this because Alana will be speaking a little bit about the social connections and isolations. Last year, we released a report on social isolations and loneliness among older persons, and Alana will speak a little bit more later today on the exciting news about the global commissions on social connections. Yet another areas for us to have this discussion about what we can do in our communities to promote to bring people together. So to meet the objectives of the Decade of Healthy Aging, we need good evidence and we need data. And so this is a multi-year project with the evidence gap map where we are doing a lot of research looking at all of the evidence on various topics, including abuse and neglect of older persons and social isolations and loneliness and others. And we are mapping it out to give you a visual look of what is out there. And so there's a short 2-minute video to explain what this evidence gap map is.
Does training in how to use digital technologies reduce loneliness? Do robot pets help people feel less socially isolated? Do interventions to prevent the financial abuse of older people actually work? It's now easier to discover the evidence needed to answer these questions, thanks to WHO's Evidence and Gap Maps, which can help us locate scientific evidence for a broad range of interventions being used across the world. Promoting evidence-based solutions to improve health and well-being is fundamental to WHO's mission to promote health for all. It also supports the aims of the UN Decade of Healthy Aging. So, how does an evidence and gap map actually work? Let's go back to our first question. When you open up a map, such as this one, on digital interventions to reduce loneliness and social isolation among older people, you'll find columns showing different outcomes, including loneliness. The rows list interventions targeting these outcomes, and at the top of this map, you'll find training in how to use digital technology. The bubbles indicate the amount of evidence available. The bigger the bubble, the more evidence there is, while the color indicates its quality. By clicking on the bubble, you're able to see a list of evidence-based studies linked to the outcome you're interested in. You can also filter your search by region, country, or other criteria. Evidence and gap maps make it much easier for governments, civil society organizations, researchers, and others to find the evidence-based solutions they need, avoid spending time and resources on those that may not work, and identify gaps in the research. And this means that together we can provide better support to more people across the world, improving their health, transforming their lives, and creating lasting change.
So I just want to finish to say that all these topics can be addressed within the ecosystem of age-friendly cities and communities, and really looking forward to our discussions about how we can implement all of this. So thank you very much.
So already I've failed as a moderator because we're way delayed, but we'll keep cracking on. So we'll go a bit more local now with an architect from Copenhagen. So we have, I have the pleasure of introducing Dominik Haldorovits, architect from Dominik and Serena, who will talk about age-inclusive public space. The floor is yours. Thank you, Yongjie. It was great, but...
Okay. This one? All right. Okay, can everyone hear me? Yes. Okay, so thanks for the invitation. As I introduced myself, my name is Dominik Haldorovits. I'm an architect and partner in the office Dominik and Serena. And the title of my lecture today is Age-Inclusive Public Space. It's the title of a book that our office had the pleasure of editing. It was launched just in time for the pandemic. So what we wanted to do is to gather the knowledge that we knew was out there on aging and space and the relationship between the two, and try to translate it into like the physical world. So we invited geographers, gerontologists, philosophers, anthropologists to give their expert knowledge and contextualize it in the physical world and try to couple it to physical examples. So in pair with the work with the book, we did a case study. That's an image of it on the side there. So the case study, the physical case study, was kind of a laboratory for the knowledge gathered in the book, and it became like kind of a testing ground for the ideas and the knowledge that we were presented with. And I think what is important to me when I thought about like talking today is that I think it's important that we address that age friendliness or age inclusion is not a set practice that we should learn how to implement, but that we should realize that we actually have a role in developing that practice and trying to also challenge the knowledge that is out there and make the knowledge more complex if that is what this topic is calling for. So I've pushed a lot of slides into my presentation today and tried to come around as many factors as I think are important. So I want to start by a short introduction about space and aging that is kind of the framework upon which I build. Then I have some spatial considerations that are based on examples that I would like to show you. And then lastly, a walkthrough of the case study that we have made. So I hope I can make it through it all. Space and aging. So when we talk about age-friendly cities or cities in general, we have this idea, this romantic idea of what a city is, that we live close together, we know our neighbors, maybe there's a bakery downstairs, that there is like a social fabric within the city that we are all part of. But the truth is that the modern city in which we live is based on a completely different model. It's a model that is functionally, programmatically, and spatially divided. And this is out of the rise of modern urban development, modern urban planning that has gathered places for housing, places for commercial practice, space for industry, and also spaces for public being togetherness, like parks, plazas, etc., into separate areas. So today, when you live in a city, you kind of need to have the possibility or the capability to move around in the city to kind of create your life within it. It places a lot of a demand on the people who are living in it. So, what is important to me is that this age, that age has also been used as a category for organizing the city, not only in this large scale, but also at a very concrete physical level. So what you can see here is a screenshot from Google Earth. It's from Copenhagen. The B in the middle is a nursing home that is kind of engulfed with its own fence. It has like a road around. And then, so that is the nursing home. It has its own gardens, its own outdoor spaces. The A is a kindergarten that is subdivided in a nursery for the small children and a kindergarten for the larger children. Then C is the school gardens where children from all over the city come to like grow vegetables, but that is also fenced off and is its own like spatial unity. And then this is all embedded in a public park that is D. So this is to say that these organizational divisions that we have in our society, they do manifest themselves spatially, and they kind of condition the way that we can work together or live together. And if we want to create age-friendly, age-inclusive environment, we need to kind of recognize that this is the context that we are working within. Then simultaneously, there is a development in spatial practice and urban architecture as well, that the common spaces of our cities, the public plazas that maybe used to be like a general space where all kinds of people gathered, is being developed even more into places that are targeted at certain age groups. So now we have playgrounds for the small children, then we have skate parks for the teenagers, and we have this increasing typology of also geriatric parks or playgrounds for senior citizens. And what it does is that it takes away from the spaces where we can all be together. And this is a historic example just to show you what kinds of developments I'm talking about. So I think this notion of age neutral and age specific is quite useful to try and look at the city or look at what we're doing in a different way. So this is an example from Copenhagen. There was this city architect in the post-war area that is called Max Sigumfeldt that introduced play streets in Copenhagen that was a network of car-free infrastructure, like going around a neighborhood, so you could actually move through a public space that was car-free, both as a child but also as an elderly person. And you can see the picture on the right is taken in 2020, so the space is still there, but it's now also been programmed, so there are benches on one end, and then there's a playground in the middle, and then there is a place to play, a space to play ball. And what is the key difference between those two is that in the image on the left, once the ball players are not there, it's just a space that everyone can occupy. It can be for a birthday or a public gathering. But then when the ball players come, people are there, it happens and then it disappears again. On the right, the ball play is omnipresent, even though there is no one playing. And I think it's important that we also address, Yongjie mentioned it before, this question of stigmatization and ageism. And I think we're very much also in this room need to be aware that we are also forcing this self-identification on people when we're saying that we're developing something that is age-friendly or for a certain age group, then we're also calling upon people to take on the identity of an elderly person so that they feel that they like fit into the narrative or this predefined role of what they want to be. And there is a glorious quote from the geographer Lars that I would like to read, and it says, "As we age, our place in society both materially and metaphorically changes. The material spaces and places in which we live, work, and engage in leisure activities are age-graded, and in turn, age is associated with particular places and spaces. Thus, the urban built environment is simultaneously a cause and an effect of ageist attitudes." So take that with you. And I think generally it's important that we realize, so what is the way that we speak or think about the process of aging. And I really like this simple thing. Maybe we should go from this modernist view of aging, that you're born without any competence and then you like develop and you tap when you're like 30 or 40 or 50 or whatever, and then it all goes downhill from there. I think we should talk about aging in relation to change. We are all changing human beings, and this change is a condition for people in later life, but also throughout life in general. So it's a complex, non-linear process that is both positive and negative, can lead to permanent and temporary change. So when the seasons change, maybe you get a depression, you can do something or not do something that you usually do. If you lose a loved one, then maybe you go through a period of grief, and it can also impact the physical capabilities that you have. So this changing human being is what we are working for. So we don't think there is any kind of elderly persona where we can say what age says about people and what they can and cannot do. So to sum up, I think the local environment and public space can influence very important aspects of everyday life. Loneliness and social isolation, the possibility to engage in intergenerational contact, physical activity and outdoor life, this question of ageism, participation in local community, and if you feel that you're belonging or that you're represented in society. And lastly, it also influences how you can experience like continuity and identity in your life. So I'm not going to go very deep in this, but I think this is also a helpful model, the ecological model, that kind of tries to conceptualize the relationship between the human and the environment. And to sum it up, it says, the less competent the individual, the greater the impact of environmental factors on that individual. This means, and what is key here is that this competence is also subject to change. So it's important that we can adapt our behavior and that our physical environment also allows for this adaptation. So when you're used to going out for a walk and suddenly you break your leg and you're not able to go very far, it means a lot that there are another route you can take, or that there are benches along the way where you can sit down. But then you're still out there and still doing the thing and adapting your behavior to your new condition. But if that adaptation is not possible, then you kind of disengage and lose that opportunity. So I think that is also important to remember. And generally, I think when working with physical spaces, agency and belonging are also two main factors that I think can be addressed in the physical environment. So agency, how do you have autonomy and readiness and ability to plan for your life? And that can be related to accessibility and universal design, etc. But also this factor of belonging. How do the spaces that you're engaged in create meaning and emotional attachment to places and people? Okay, so Then there are some spatial considerations that I would like to talk about. I will just look at the time. So if this adaptation is important for a changing human being, how can space then provide possibilities for that adaptation? Often people ask me, like, okay, so where can we be age-friendly? Where should we do it? And I say, everywhere. It's a continuum. You should think of age-friendliness or age-inclusive possibilities as a continuum from the closest places around your home out into the city. And my theory is that it is only when we see the places as a network and when we see the city as a network that we can truly work in an age-inclusive way. So what is important, because also the city looks different from person to person, right? Some people can only access their nearest environment. Some people cannot even go outside of their house. So how do you create meaning for them in the built environment? Some people have a limited urbanity where they're able to walk within some distance, but not very far. And some are young and, or not young, but feel young and can move around the city freely, right? So I think it's important that we create these possibilities for agency and belonging in every life phase and every situation in every city, so to say. And I think it's important that we widen our understanding of what a meaningful encounter can be for people. So in our book, we have a contributor that argues that has been doing research into that even gazing out of the window can be a meaningful social encounter for someone that is bound to their home because they feel like they belong to a daily rhythm of society. So this is stretching or enlarging our understanding of what is meaningful for people is important. Then there are spatial considerations you can take. These are two examples from a nursing home, and these are old ones. These are from the 80s. By Hermann Herzberger, he kind of conditions a social meeting place from the threshold of a nursing home room to the common area. So there is a half door that you can still stay within the privacy of your apartment, but you can also address people or signal this receptivity to being in touch with other people. The other example is from the same nursing home, but in a different unit, where there's a little covering, so you're covered from the rain, and there's a little bench for your friend to sit down. But it's an encounter that is very subtle. You don't intrude into each other's spaces, but you create the opportunity for them to meet. There are a lot of overlooked, uninteresting places in all kinds of structures. So these two images are taken 30 or 40 years apart. It's a landing on a staircase within apartment block in Berlin. And it kind of signals that there are people that are caring for the space, like looking at it and using it for encounters in the neighborhood. And lastly, to say it's also not only elderly people who kind of need us to be more considerate towards every kind of different life situation. This little family, they're on their balcony. A balcony is maybe not a new spatial typology, but it's here they're able to take part in the public life that is on the street below because they have this balcony and they don't need to run after their toddler in this crowded cafe. And if you kind of pay attention to these kinds of possibilities, then you can also start to work with them. So here is another housing block by Hermann Herzberger, also in Berlin, where he sees the balcony as like a typology that you can work with to create a good neighborhood. So there's part of the balcony that is covered, that is private, and part that juts out into the common space and allows for people to communicate across. So there's one part that is private, and then the other part that allows for neighbors to meet all across. Another example of a staircase that is also a social space, this kind of neighborhood space where you also have this aspect of time, a place where you pass through a lot of the time. You know, you can learn to know your neighbors, but you don't need, in this case, it's like a closed off street, so you don't have to, you can rest down in the space. There are some chairs over there, but you can also stay up on a loggia covered from the rain or in the shadow if you want to just be part of it at a distance. And then some examples also from post-war Amsterdam. I'm sorry that my examples are very old, some of them, but they point to some essential knowledge. Like here, Aldo van Eyck like finds a place in a street that is just a vast infrastructure and like carves out a public plaza by just widening the pavement and creating like a neighborhood space. So it's not like a huge undertaking, and it doesn't follow any kind of big master plan, but it creates a space for the neighborhood. And the next image is the same, so it's like a roundabout that suddenly by being connected to the pavement, it creates a place, a plaza, a gathering place, somewhere where the children can play and where neighbors can come and meet each other. And this, what I find very inspiring in the work of Aldo van Eyck, is that he doesn't use this great master plan. He just finds spots within the city that are decentralized and develops them one by one by one. And then he ended up creating almost 600 of these kind of neighborhood spaces. Then it becomes like a starry sky of interventions. Again, this idea of the city as a connected network. And also in this kind of example, you can see there is a variety of benches or opportunities you can choose. You can stay on the edge of the plaza that is like over here. You can so you don't need to be in the middle of everything that is happening. There is space for you to meet your friends. There are some benches that are in the shadow, some are in the sun, some are facing what is happening, some are facing away. So this opportunity of different kind of participation, I think, is quite important when we talk about age friendliness or age inclusiveness. So this, I think the task is to consider how we can create opportunities for multiple forms of engagement in order to host different kind of lives. You can be a passerby, you can stay on the edge, you can go there with your children, you can, or grandchildren, you can stay at a terrace. It's a kind of intertwined or integrated into the city fabric, this kind of playground here. Then the next thing that I think is important is this notion of integrated spaces. So not pointing out, we want to make this space elderly friendly, but look at the city as the way that we use it, the way that you move about it, and realize where are the potentials. Maybe there is some space where you just need a bench or some covering from the rain, or somewhere where the red light should not change that fast. Tokyo has quite a large network of water that the city has built upon. Many of these old canals are buried underground now, but there's an example of this Iwatogawa River Park where they have used the logic of the old waterway to create a green infrastructure that cuts through the city. It's a pedestrian infrastructure that kind of connects to different parts of the street. So it's a network of many kilometers where people can move about in the city in a different logic away from the cars. And what is interesting here that it's not only a pathway that you can walk on, but they have carved out spaces for small playgrounds, small resting places, like an outdoor gymnastics area that also a local nursing home uses. The paths connect to like local libraries, supermarkets, etc. So it's an infrastructure that creates possibilities for a whole other a set of users. And this is another example of like bottom-up growing a space. This is another example from Japan where an elderly institution has started to buy. Can I point with this? Over there on the right, it was the first building that they had. They tore down a gate or like a fence to the street and created this like pathway to the school that is over here. So suddenly they have created a public space out of a private garden and planted a tree that is nice for the children to climb in and keep sure to maintain it. So they have like not created something only for the residents of the nursing homes, but also given something to the community. And now there are children who come there and buy candy from the elderly ladies. What I think is very nice in this example as well is this, it's not a general space, it's not like a park, a public park maintained by someone that has nothing to do with the place, but it's actually maintained by the residents, and they also have a sense of ownership of this place. So they are happy to like make a barbecue or contribute to like local festivities and stuff. But on a more formal note, this is also happening in a different scale in Copenhagen. So these are two like schoolyards that like extend out into the public space, one in Vesterbro and one in Nørrebro, so that the activities that are going on within the school like kind of activate the public space. And I think why aren't there any nursing homes that do this, for instance, so that you create some opportunities for people to meet. Because I think, so this is from an assignment that I'm currently working on, and this is just to show you how ingrained this division between ages is. So the brief that I was given for transforming this courtyard was the one on the top, where they want the children for 3 to 7 years up in that corner, and the children 8 to 12 in another corner, and then the teenagers are a little bit around, and then the senior citizens have like a spot for themselves in the middle. And I think it's this kind of way of thinking that also leads to many of the spatial divisions that we need to bridge. Finding out like what is the value of sharing locations and what is the value of programming locations together so that you kind of get a mix of different citizens within different spaces is important. And how do you work with spatial boundaries? So these are both playgrounds. One of them is integrated within the park. The other one has a hedge and around. Away from this like functions and programming, maybe you can also talk about public space more from an atmospherical perspective. How can we create different experiences? So this is Sunken Garden Plaza in New York, where there's a togetherness around that situation that is very informal. You don't do anything, but you kind of experience it together, and that in itself can bridge age differences. We should also be aware that we live in dark countries. Maybe light conditions could be part of our designs. The changing seasons is something to work with, and how do we create places that are for everyone. Okay, I have 5 minutes left, so I will go through our own case study that we did, as I said, parallel to the book. It's a classic Danish municipal context. A little village outside of any major cities. It's in Møn, for those who know that. It's a little village with a supermarket in the middle, a nursing home up above, senior housing to the right, then a kindergarten, and otherwise just like private housing along like a big road. And this was subject to an urban renewal project in the city, where the municipality had done an involvement of local citizens at all, but the nursing home residents and the senior citizens that were living right next to the site were of course not included in any way in this process, because they had just called for like open meetings where everyone can come, but not everyone can come and say what they want or what they need in a setting like this. So we kind of developed a way to also reach, like we went to home visits and did a workshop at the nursing home to see like what can we get out of asking people other questions. We didn't want input to our design. We wanted to understand what is the reach of their daily life. And you can see some examples here. These are extremely like limited urbanities. These were the places that they knew or that they visited. We wanted to talk about atmosphere and like about landscape qualities. Like, are there, so we gathered like these glasses from different landscapes in the region and talked about that, and it became apparent that this kind of like beach landscape, Møn is an island, it was a landscape that was very dear to these people. So maybe we could use something of that, maybe also trigger some of these memories. And we kind of realized by this mapping exercise that even though the municipality had a plot on the backside of the supermarket, that would be a space for that urban renewal that would be completely irrelevant for these people, because they use the supermarket and the entrance to the supermarket as their public space. So after some negotiations, we managed to actually move the site of the urban renewal, and we're able to create like a small plaza in front of the supermarket. And what we wanted to do is to create like an extension of the social meetings that are already taking place and giving them space to happen. So we don't need to invent the life from the bottom up, but that we just make space for what is already happening. Even though it's a small place, there are different opportunities to take part in it. There's a seating place down there for the bus, the people who are waiting for the bus. There's some seating across the entranceway, but also some different places you can choose. Maybe the people use it from the nursing homes when they get visitors. They go down to sit on this bench here that is a little bit away from everything that is going on. So this multiplicity of places. It was important that it worked in festive occasions, but most of all for this everyday life, considering that these are also spaces, this public encounter that these people have might be the only encounter in their day. And they said that. They're like, we're going to the supermarket just to exercise and to socialize. And we also tried to embed like the comfort needs, like backrest, armrest, high seating areas, etc., into like a cohesive design. So it's not something that signals age inclusion, but that it's just there for the people who need it. And this creating, I'm not going to talk about so much about it now, but creating different kinds of opportunities. We also know that we read spaces and with our bodies. So a stone that the grown-ups might just look at, a child will just jump on it. And in that way, you don't have like a swing that is empty 90% of the time, but it's just an element that someone can use in one way and another one can use in a different way. And it actually works. And also universal design. We knew that we wanted to make a universal design project. So and the entrance to the supermarket, we wanted one entrance for everyone. So what we did was like lift up the whole terrain of the plaza, just a couple of centimeters, and it allowed us for like a super smooth universal design entranceway. And this question of atmosphere, like trying to locate this space in that particular context. So drawing on this narrative of the beaches and the stones that are like back in the pavement or like a part of the design, local flora, local colors, local smells, and like recognition for people. So it also belongs in the place where it is, changing throughout the seasons with different structures. And that's my last slide. And the book is sold out, so if you want it, you can actually only just buy it from our webpage. There are just a couple of copies left. So, yeah.
I'm very pleased to introduce Helle Stentoft Dalum, Deputy Director, Danish Health Authority, who's here to talk about Usable City for Seniors, a toolkit. Looking forward to it. Floor is yours.
Hello, everybody. Thank you. And thank you for the presentation. What I would like to talk to you about, sorry, I just have to start this, is three things. First, I would like to give you a short introduction. I guess Denmark and the older population is a lot similar like the other Nordic countries, but we just start there. And then I'll tell you about this idea catalog we have made, actually in collaboration with Dominic and Serena. So maybe some pictures are recognizable for you. And then I'll tell you about the toolkit. And finally, we have a grant actually where we use this idea catalog and the toolkit to provide, we have this grant we give out to municipalities in Denmark, and I'll tell you a little bit about that at the end. So this is just the picture of Denmark now, or in 2020, and in 15 years ahead. And as you can see, we are getting an older population, and what we can't see of this very simplified model is that the number of people above 80 is also very increasing. So we know we're getting a more aged population, and that demands more needs, but also, as we look at it, it's also a group of people with a lot of resources and a lot of energy to bring to the city, and we have to look at that as well. Yes, this is just to give you a sum of the Danish senior citizen politics. In the Danish senior citizen politics, we are focusing very much on promoting and extending the independence of senior citizens, and we're also focusing on when you have a decrease in your level of functioning and you need care, you need health service, you are unsure to live as a continued self-sufficient and well-being, a life in well-being. And we also have a lot of focus on dignity in care and a lot of focus on autonomy. And that's actually the guiding principles. So in Denmark, we talk a lot about that you're living as long as you can in your own home. And that's also mean that you're living in your own city, if you want that. Being in your home is one thing. You also have to be able to go out the door and take a walk, for instance. So the whole idea of an age-friendly city is very important in that context. And we also, in general, have this focus on a person-centered approach to care and a lot of focus on rehabilitation. So the steps of Danish senior citizens policy is that we have a focus on prevention and the healthy aging, which is very much a focus here, but also a focus on reablement. If you have this decrease in function, we have structured programs for rehabilitation and reablement towards seniors, and then we have a focus on welfare technologies and the use of intelligent use of these technologies. And sometimes they also integrate with what's happening in the home and what's happening outside the home as well. And then, of course, we have this public financed sector of long-term care. So you get free long-term care if you need it. And also, we've seen some of the pictures or overviews of the nursing homes from Denmark as well. And that's one part of the home care in Denmark. And then we also have this home care in the home, if you still live in your own house or apartment or whatever. So this is just an overview. Then I will tell you a little bit about this idea catalog. And we were able to get this great grant in 2019 and actually be able to make a profound kind of investigation, you can say, or analysis of what are the different needs that seniors have across Denmark. This is a map of Denmark. I know we're one of the smallest countries in the Nordic, but still we are very different, we think. We're very, people are living in different kind of cities in Denmark. We have Copenhagen, which is an urban city, and then we have small cities out in the countryside, small villages, where it's another dynamics and another cultures, I don't know if you can say it, cultural codes, but another way of live your life as an older person. So there were made a very profound qualitative study to find out what are the needs of seniors in different places. And as you can see, different places around Denmark. And the focus was very much to talk about what are the needs, and then there was, alongside this, made a literature study. There were different dialogues with experts to get more knowledge about what are the seniors' needs and how can we make sure that they are heard in the urban development. And there were also done a lot of observational studies around different places in the cities to make sure that we get this perspective as well addressed. And then also a trend study. So really multi-factual mixed study was this base of this. Then I'll just give you an overview of one of the what the results of this profound study. I'm afraid I haven't brought we have actually books, paper books, and I'm thinking about maybe we can go by the Danish health authorities so I can give you some copies or have something to show you. But we have this really great book. You can also find it online. I can send you the links. But where we have divided different needs, which are which the different seniors have expressed. And it's, in some senses, it's very plain or very common sense, but in other, if you really look at it, it's really important that we stop up and listen to what different needs really say or really are all about. So the different needs are, I feel safety in the city, that I see nature in the city, I feel like I'm a part of something in the city, I have something to attend to in the city, I feel welcome in the city, and I feel free in the city. And just like Anne-Berit said, these are needs for all of us, of course, but maybe they are in another nuance or another shapes of color or whatever when you are from an older person's perspective as well. So I'll just deep dive into a couple of them, and then so you can hear more about it, or you can read it. It's in Danish, but maybe you can read it or Google Translate if you want to find it online. So this is just from the idea catalog, where we have focused on the need of I have something to attend to. So the senior citizens are saying, for me it's important that when I think of the city, I have something to do. It's a usable city, it's easy to live my active daily life. There are many reasons to visit the city. There are some reasons that I have to go out of my own home to be out in the city. So for them, it's very important that there are something that they find, how can you say that? That they find it's something in it for them to go out the door. And that's, again, common sense, but very important to stop up and think, if we look at all age groups, do we have something worth for a senior citizens as well? Sorry, just mixing up, and I have some quotes as well. Yeah. So what we are, what we would like to do is to people planning a city developments or trying to renew their cities should stop up and ask something about what are the spaces and activities that the city offers for our senior citizens, for instance, plus 65. And where can you meet across generations, which are very much aligned with what Yongjie said about intergenerational meetings and so on. And how does the city somewhat encourage citizens to engage or to go out the door? Is it easy to access? Are there new challenges? Are there areas of recreation and so on? So that's worth stopping up and answer. And then there's a recognizable picture from Møn, where like Dominic just said, where they had this focus on this age-friendly urban space to make sure that you actually say, oh, there's something for everybody and also for older citizens. Yeah. I'll just tell you a little bit about one of the other needs. And this is the need about feeling secure. And feeling secure when you're a senior citizen is maybe not the same as feeling secure when you are 5 years old. So that's why it's very important to ask the population that you want to hear the answers from. So the seniors are saying that in a usable city, everybody feels secure. You can explore the city safely in the time of day or night, you're both in familiar places and unfamiliar places. So the traffic is well regulated, and it's safe for everybody, and it's no matter how fast you can go or your pace. And that's really, I think for some, this is very important to get this, remember this perspective that, for instance, lights on the street is important if you have some difficulties or afraid of falling when you're walking. It's important that you know how the traffic is going if you don't feel you can go as fast as you once could, to be able to quickly pass the street and so on. So have this in mind when we are thinking about what is security and how does it feel from different perspectives. It's very important as well. So one of the questions the city could ask is the city considered safe in unfamiliar places? So if For instance, you have a senior citizens attending a park or something for the very first time. Is it safe for them? Are there dark places that could be unsafe for some reason or whatever? And also, are the seniors capable or able to walk by themselves in the city without feeling insecure? And that's both when entering and exit the city. Is it easy to go out in the city, or like in Denmark we have a lot of pavements and bicycle lanes, but sometimes the bicycle lanes means that it's like a highway for bicycles. What if you go with the, I don't know if I call it in English or later in Danish, if you go with this roll thing, can you cross this bicycle lane in a safe manner? Is it okay for you? So kind of stop up and just take the shoes of a senior citizens. How do they feel safe in this city? Okay, and this is just an example for inspiration. In Denmark, we have like I guess you all have, a focus on people with different decrease in functionings. One could be a diagnosis of dementia, and we have this card in the city of Odense, where you can bring your card and then kind of show that you have a special need. We have also some have this sunflower string. Maybe you've seen that out in the picture street. Also a sign of I have some difficulties. Please help me and please be patient with me when I'm attending traffic or out in the street or in a shop or whatever. So this is also a way of feeling safe. Okay. Then I'll tell you a little bit about the toolkit, because we have this toolkit we call it Brugbar by for seniorer, which is usable city for seniors, not age-friendly, but it's like, what our words creating. And we have this toolkit, which is very much focused on how can you engage seniors when you're developing your city, and very hands-on way to do it. So I'll just tell you about them. So first of all, if you want to do this and you're serious about doing it, then be systematic about the involvement of seniors. And if you do it, then you have a higher possibilities that the seniors will use the city more, or this area of the city more afterwards. So it's kind of, if you want to have the users using it, you have to involve them in the planning and the creating of the city. And this is just some good examples of how some seniors, what some seniors have expressed, that they say, for instance, that they say, my voice do not need to be heard, I'm old, you don't need to ask me, or some have said, oh, the city doesn't care about me, or the arrangement about urban space doesn't interest me. So why is that? And have we made the effort to be engaging in the right way? And this is where we have this toolkit with the ways of engagement. So for instance, the different points where you can engage senior citizens is when you are planning the process of either a new a development of a city or a building of a new area in a city. And that could be in the politics, the strategies, when you make a plan for the visions. That could be, in Denmark we have this local district plans, which is mostly in the building or area department. That could be a way of involving. And then we have, of course, when we have the new renovations of different areas for apartments or different areas of the city, that would be a point of involvement also. Some of the things that we recommend that you are aware of are, of course, the language and culture barriers. So when we look at who are the ones, that's always something we have to be aware of. And we are, for instance, like we are a public authority asking the citizens to do something. Are we in the same, how do you say that in English? Are your eyes in the same level when you speak? Can you see, can they understand what we're saying? And are there any cultural barriers? We talk about health competences when it comes to healthcare. And here again is some competences in understanding what is the plan of it, what's in it for me, and how do you want me to engage. So that's very important to be aware of. And then, of course, are there any social or physical barriers? Could it be something about they haven't attended a public meeting like that, or it's too far away if they live in a close apartment building and the meeting is down at the town hall? Would that even be possible that they attend, and so on? So kind of think all of the different ways of engaging, what could be some of the no-goes for some people, and if you want them to be part of the process, then make sure that you are really curious about how to plan it in the very best way. So these are some of the different ways of doing it: insecurity, digital barriers, and so on. So this is some very hands-on methods for involvement. The first is about interviews. You can interview your senior citizens. That's very easy. Of course, be aware of how to do it and make sure that you know how you use data and so on. You can do it in different ways. You can come by the house or sit by the citizens on a bench. You can go along, taking an interview while you go for a walk. You can make in-depth home visits and ask more about what are the preferences, what are the cultural background, and so on. And you can also do it in groups or by telephone. So different ways of engaging when it comes to interviews. Then there are different ways of using digital online media. That could be questionnaires. That could also be something about making a homework assignment. That could be taking a picture on your way when you're out for a walk as a senior citizen, send it in to the municipality or something else. Still a way of engaging and using the technique, the digital possibilities. Then there's also the part about observation, and maybe some of you have already attended or used it as a way of approaching your way of development. But this could be area observations, like you go out, sit on a bench, go on the bus to see what's happening, how is people getting in and out of public transport, or how are they moving from the library if they want to go to the park or whatever. So kind of see what's going on, and also are there some patterns that are interesting for others to know, and so on. And also maybe a simple thing as counting how many people are attending the park. If you thought that this area of the park would be very age-friendly, are there any seniors attending during a week or during a Sunday or whatever? And how is that? Maybe they are, maybe they aren't, and so on. Why is that? And finally, there's this element of co-building. I'm not an architect, so I'm not that familiar with the term, but the idea is to kind of get things in your hand, maybe make small modules. Like in Denmark, we have a lot of Lego. Play with that. Could you build something, or maybe with other materials, like kind of participate in a kind of physical way in creating the prototypes and so on. So this is also a focus of implementation. That could also be if you are planning on planting a lot of flowers. Who are to plant the flowers? Is it some professionals, or could somebody from the local community participate? So on, to kind of make the engagement also in that way. So finally, there's mentioned some ideas about future uses. Like if you want to, again, think how can we do this? Could you make some future scenarios? There's also a method you can use. You can look at different trends. Now you get a lot of inspiration from other cities. You can take it home and say, how would that be in our city, in our country? And maybe ask the senior citizens, so we have heard about this. What do you think in 15 years or in 60 years? It's also about who are you asking now? You're asking the citizens that are 70 years now, or maybe the people that are 50 years now. Who is the age group that you are attending, and what are your plans for in the longer shot in some way? So then I'll tell you a little bit about the public grant before I close up. these are the two products that we have and you can find. We would like them to kind of live out in Denmark and kind of make an impact in the Danish municipalities. And we actually had this opportunity that the Danish government set out 30 million Danish kroner to a big grant and said that we want the municipalities that can apply if they want to use these different tools, the toolkit, but also the idea catalog, to kind of use it when they are developing their cities, their areas in the city. And we have just closed the application date. Some of the, and I think we have a lot, 10, 15 municipalities wanting to work with this. We're still certain to find out who's going to work with it. But often when we have interventions like this in the Danish health authorities, we are very focused on what are the effects, how can we see it change, how can the municipalities kind of tell us that when we do this, we hope or we plan that this will happen to the citizens. And one of the things that we want them to reconsider when they have applied this grant is that they're focusing on how can this, when we, first of all, they had to use both some of the needs. I mentioned the 6 needs. They have to be sure of what needs are we addressing when we have this development project. And second of all, they had to use different tools like the methods I just mentioned. They had to be very certain about, are we interviewing seniors? How are we engaging them in the process? And then what we hope to find out and what we want them to be very certain about is that how can, when they have their project, local project, how can it bring more happiness to the senior citizens, and also how can it kind of support the intergenerational meetings and also support the more active lives. So we're very excited to see what's going to happen the next years. They get the grant in the start of 2024, and then they have a couple of years to working with the projects, and then we get the evaluations into 2 years after this. So this was my presentation. Thank you.
Thank you so much for that. That was really interesting and such a great tool. I really liked the sort of personal touch that you have all these quotes and this narrative, rather as a categorization as well. It talks about security, activity, well-being. So I really like that. And I sincerely hope that this major grant and all this interest and activity translates into Danish cities in the Nordic and Global Network. So let's try and aim for that. Now, first of all, I just wanted to, because we have the speakers with us, are there any questions? We have microphones on all the tables, so any questions, reflections to either of our speakers? You've all tried it now, so you know it works, and English is fine, and we're among friends. No? No one dares venture into it. Yes, fantastic. Kenny.
Kenny from Uppsala here. This is not as much a question as my thoughts right now is that there, throughout all the presentations, actually, there are strains that needs to be connected. Also, I would. What do you think about? We need to sort of pull thoughts together, pull the physical aspects with the overarching health issue aspects and the toolbox issues. There are always, it's a bit of a frustration from my side, I believe. It's always these different strains, and they are all good, each on their own hand, but we need to find, what if we could develop some sort of strong common concept from all this? Is that just a naive thought, perhaps? Okay, so that was some reflections.
Well, I actually think age-friendly is the binding strong concept for that, because it does entail all the different areas that we're talking about: the outdoor environment, the transport, the housing, the activities, the involvement of older people. But I think we need to be using it, reusing it, keep repeating it, so that we all get to the same level of knowledge. The planners, the housing experts, the transport, everyone needs to be on the same page, and that requires an effort. But if it's any consolation, I think all of us can say that the main challenge with age-friendly is getting all these different sectors together. But we just have to keep trying, because it's when we actually manage to get them all together that we really create age-friendly spaces. And I also like Dominique's perspective on that every space can become an age-friendly space. A landing on stairs or a little pocket park, or we don't always have to think these huge development projects. Small spaces can also become age-friendly. So that's something that I took away from it, at least, and really liked. Anyone else? Being as courageous as Kenny? Come on, no? Yes?
Maybe I'm drawing out a little dark picture here, because I'm working in the healthcare sector with quality improvement in our health system, in hospital systems. And we see fantastic result that we can prevent the non-communicable, NCDs, heart attacks, strokes, and so on, because we eat better, we have activities and so on. So we see a new kind of disease spectrum, which is infectious diseases, and the COVID and so on. But we see that, and that's mostly the elderly. So I was thinking about having lots of architects here. The sometimes challenge between the social connectedness and the disease control, infectious disease control, because that's a huge challenge we have in the healthcare sector. So, and it's the healthcare is one part of this domains. So I was thinking, and I'm new here, so maybe I've talked about this during the COVID, I don't know. But what's your ideas of thinking as architects and designers of the public system in order to be disease preventive in that kind of aspect?
Okay, thank you. Would one of the architects like to venture an answer? Dominique, or I think there are some other architects as well, but you give it a go, Dominique.
I can give it a go. I don't think I have any clear answers, but I think there are many considerations, right, that we need to take care of, and we always, especially as architects, there is always a consideration towards the practical or the economical or the social or the. I think. Maybe this is just one more consideration, right? That we need to say, okay, then we have this problem with the spread of infectious disease. That is something that we need to counter into the work that we are doing. But I think from an overall perspective, I think it's about quality of life, right? So what kind of lives or social gathering places, or how do we create this sense of belonging or agency for an elderly population, right? And then, of course, there are many different factors that we need to consider, and that would just be another one added to the long list of other considerations that we need to factor in. But I think it's also important that I think with this monumental tasks, as we are standing here with creating age-friendly environments, it's also important that we maybe keep on being positive, right? And see, okay, what good can we do instead of being afraid of failing, right? So we don't need to do anything. We don't need to do it perfectly, and then afterwards say, oh, look at this great example. But keep on pushing the agenda and trying to implement it and integrate it in all kinds of tasks, I think is what we're striving towards, right?
Couldn't agree more. We need to try different ways of doing it. I know some municipalities in Norway, they do not have a separate public health plan. Rather, they have public health in all plans. And so there are different ways of thinking more health in all policies as well, which I think maybe is part of the answer to your question, that we do need to have health in all plans. Anyone else? Yes, Thorhildur?
When the guys start to talk, I always feel I have to do it also because we can let them be the only one had to have the courage to talk. But what I'm thinking about when we are talking about spaces, it's not only the physical spaces, it's also the spaces in the society and where older people, which they have so much experience and wisdom, and in our system, we have to create a space for older people to express their opinion about things regarding themselves. And we have to also think about a democracy regarding where is their space in the society. And I think all of us are trying to do this in making the cities and the society more age-friendly, to have this space too. And if you think of from that place, we can use it everywhere in all the discussions. So that's something I feel it's important to don't think about older people like health problems. More, of course, we have to think about it when it comes, when people start to be fragile and need some more care. But there's so many old people with so much wisdom, and they maybe when they stop working, they don't have a venue. So we should create these places for older people to express what they need and how they want society to be for the last years in their lives. Thank you.
And I think also keep in mind that everything that we try and do with the age-friendly development is trying to promote inclusion, activity, that people feel they can use their outdoor spaces, live at home for as long as they can, use transport, be active. And by doing so, we do postpone the need for, hospitals or health and care services. So that's always the rationale that we have to keep in mind. So let's try and make a big effort so we don't need as much health and care social services. Anyone else? Yes? Sorry, I don't know all your names, so it's not to differentiate, but some are old colleagues, so I know their names. Sorry for the new ones.
My name is Eva. I'm from Lithuania and represent Dementia Lithuania. And I was thinking when I was listening to the questions as well about this, that people who, the choice, the possibility of choice and practicing choice is probably something that we all aspire, and we have this different starting point to come to this conversation. And as we choose, there's always some type of risk, and that we have to acknowledge, and sometimes that experience and what we get out of that has a proportionate risk. And when in the context of dementia, there's always this conversation, keeping people safe and keeping them alive, and really where we find ourselves in between these two things. And so when we develop these public spaces, is always, I guess when I was looking at the presentation from Dominic, I was thinking about the public spaces, and I guess, parents probably would look at that and think, are their kids safe in that space, because there are other people passing, and is how they look at that. And then other people would, so there's always this balancing and measuring and practicing the choice. And so really great conversations by now. Thank you.
Thank you. And I think at least if we always invite older people or the society at large to conversations about what do they want their societies to look like. If we keep on doing this social engagement involvement with people, then at least we create societies that they can recognize, that reflects their wishes and needs. So that's also why the involvement, particularly in this context of older people, is so important to keep on doing it. Anyone else wanting to venture it? Yes, Alana?
I don't know if I can speak and look at you at the same time. I feel a bit rude. So thank you very much for the very exciting presentations. I think one of the great strengths of Age Friendly is the focus on action, on doing things. I was wondering if you could both speak to the issue of evaluating impact. So I asked Dominique already before, had she evaluated the work around the case studies? And that hasn't been possible, but I'd love to hear from her around, if she could, what would that look like? What sort of evaluation? And I'd love to hear from Ellie in terms of what are the prospects, or what are you planning on doing in terms of what is really a fantastic investment? How will you evaluate success? So if you could both speak to that, I'd be grateful.
Thank you.
Yeah, okay. Yeah, I think it's a great question. And as I said to you before, it wasn't possible for us to evaluate on that particular case, but we have done evaluation by ourselves, actually, by going back there. Many architects do not go back where they once worked. But for instance, for us, a measurement of the success of the place is not only that it's used and that they're, like the village has moved their Christmas tree over there, right? But it's also the fact that the woman who is in charge of selling the flowers in the supermarket that are like adjacent to the landscape that we have made has actually like fit the selection of flowers to match the flowers that are in the. So it's also this kind of. It's a little bit also ephemeral, this testing. So what does it mean, like, to evaluate, right? Because we can always, it's always very easy to evaluate on numbers, right? But this qualitative evaluation and like trying to, and that's what I'm also saying, that this creation of belonging or creation of like a relationship to place, these are ephemeral things that are hard to measure maybe in like a research context maybe, or there are people who do that. So I think it's important that we also try to say what are the effects that we're looking for. And for me, for instance, when I stay there and I see men, I know there has been studies done in that area in particular that has been looking at loneliness amongst elderly men. And when I see a man like going from his car into the supermarket and then resting on the bench that I have made for just a couple of minutes, and like he drinks some milk and then he goes to his car, and then I like kind of feel, okay, there is something here, and that and I think we're also in this, when we have this evaluation conversation, so what are the elements that we're trying to evaluate? And I think that is very important. And of course, I would love to see the broad range, right? So both the numbers and the like hard data, but also this kind of like, can we talk about those ephemeral things also as something that is a criteria of success? So maybe widening what we are trying to evaluate, I think, is a path forward.
I can just answer my part. Thank you. And thank you for the good question. Just to address our Icelandic friend about this idea of engagement, I forgot to mention that we have actually set it as a demand when they have to apply for the grant, that they make the proposal together with a senior citizens organization, a local organization, so that we make sure that the co-creation starts from the beginning and not along the way. So it's just to make sure that the political aspect is and the democratic aspect is very important as well. About the effects and evaluations, this is invitations to all the researchers to follow the project, I would say, because we don't have in the grant, most of the grant is out to the municipalities. So there are not a lot of money to make a huge evaluation, but we have set demands that they need to focus on what call it life quality or happiness for the older persons. They have to focus on this creating integrated meetings and also active life. So they have to make it reasonable when they make the application that their project can make this difference. And when along the way they send in status reports for the Danish health authorities, they have to address how are things going with these different indicators that they have to address. So we can follow it, but not in a nice big evaluation setup, but maybe some of you will.
Thank you. Do you feel you got an answer, Alana? It's a big question, and it's a difficult question as well. A lot of it is about participation, that we see more people, out and about using the benches or being active, taking part in activities. But not all of it is easy to measure. But I think we need to become more and more aware of this, and this need to measure the impact. Also, as economies are tightening up, in order to get funding, you do need to show results for what you're doing. So, and I think often we get lost in the whole getting political support, getting a momentum going, building knowledge, and being active and getting it set into life, the different projects. And then we sort of forget that, but what actually happened? How were they used? What impact did it have? So, so important question, but also a tricky one. But we can always get better. So now we're going over to Sweden. I have the pleasure of introducing Oskar Jonsson, Assistant Researcher, Lund University, who will tell us about a citizen science project on housing accessibility. Floor is yours.
Thank you for the presentation. And I want to talk about a citizen science project on housing accessibility involving senior citizens in Sweden, including an evaluation study. In the background picture here, you can see a person participating in this citizen science project by assessing barriers in her home with a folding roller and registered yes and no to 40 items in a mobile app, co-developed in the project. And this is the topic of my 20 minutes presentation. My name is Oskar Jonsson. I'm a furniture designer by training, have a PhD in industrial design, and now working as an assistant researcher in the research group Active and Healthy Aging, Department of Health Sciences, Faculty of Medicine, Lund University, Sweden. And the societal challenge targeted in this project is how to engage older adults in citizen science as an avenue towards impact on matters relevant to them. The focus of this presentation is physical housing accessibility, and it's just one important piece in the age-friendly city jigsaw puzzle. Obviously, there are also other aspects, dimensions, domain to be considered. And yes, I'm affiliated to Center for Aging and Supportive Environment, CASE, that works to develop knowledge on competence on aging and health. The center works with a focus on supportive environments for the aging population. And CASE consists of 9 research environments from the Faculty of Medicine, Engineering, Law, Social Science, and School of Economics and Management. And the current research themes within aging and health are housing, public environments, technology, marginalized groups, and social rights. Professor Susan Iverson has recently handed over the coordinator position to Stephen Smith, that you can see in the picture. And okay. And in this picture, you can see Susan Iverson, that is the PI for this citizen science project, and also Stig Åhlund, that is the chair of the CASE user board, and we try to work in close collaboration with our user board, with people from the society in different positions. And Stig is a representative from one of the pensioners' organizations in Sweden. And they are pilot testing this mobile app and assessing potential barriers in an entrance. And the aim of my presentation is to reflect on the advantages and disadvantages of engaging older adults in citizen science project to examine the physical accessibility in their home. And only 4% of people aged 65 and older in Sweden live in residential care facilities or nursing homes. In other words, 96% of people 65 years and older live in ordinary or mainstream housing stock. And how do we know that these homes are suitable? to older adults, how do we know that they support well-being? And you can also see on the table here that people aged more than 80 years, it's 12% that lives in nursing home or residential care, and for people that are 100 years and older, it's 52%. And in 28% of the Swedish ordinary housing stock, residents are aged 65 plus, and housing matter is high on the political agenda. And following the national tradition of annually recurring citizen science project in Sweden since 2009, housing accessibility was chosen as the topic in 2021. The housing experiment was implemented as a collaboration between Public Science, an independent Swedish non-profit membership organization that works to promote dialogue and openness between researchers and the public, and researchers at CASE. Other partners included the three largest national senior citizens association, as well as the software company Meetings. All residents in Sweden were welcome to take part in the housing experiment. However, it was the first time that older adults constituted the main target group for the annual National Citizen Science Project. And the housing experiment was launched as part of the European Science Festival, European Researchers' Night, where thousands of children of citizens, primarily school pupils and teachers, have helped researchers gather huge amount of data. Therefore, it was an intergenerational ambition in the housing experiment, linking children with older adults. For example, curriculum-adapted material was offered to teachers and pupils to use. Citizen science projects are often positioned within the natural science, like the Ladybug experiment in 2018, and targeted to teachers and pupils. So what is citizen science? There's a plethora of definitions and interpretations of citizen science. However, there are similarities such as democratization of research. Citizens generate an amount of data that would be impossible for researchers to collect on their own. It's real research with systematic approaches, established methods, quality criteria. And the citizens have the possibility to participate in several phases of the research, such as preparatory phases, execution phases, like data collection, and translational phases, like dissemination. And results published in the scientific original publications and popular formats. However, to assure high data quality when data is collected by members of the public is a well-known challenge in citizen science, and sometimes different stakeholders define high quality in different ways. The links to the right in the picture leads to platforms in the EU and EU countries like UK and Sweden for get information about ongoing citizen science project. And there are two research questions in this project. And the first is, what interest and capacity do senior citizens have to contribute to reliable and valid data collection on aspects on housing as part of their execution of active citizenship? And I call this the evaluative study. And the other question was, what is the character and magnitude of physical environmental barriers and accessibility problems as recorded by senior citizens in different types of housing and residential areas across Sweden? And I call this the descriptive study. And to live independently, active and healthy in later life, societies needs housing that has is designed to meet the needs of older people. and large-scale reliable information on accessibility problems in ordinary housing is lacking. So the question was, how accessible is Swedish housing? And a fundamental starting point was the Housing Enabler screening tool. And it's actually built on what Dominic mentioned about Lawton's and Nahomi's ecological model of person-environmental fit. And the screening tool is a reduced version of the full Housing Enabler instrument that has 161 items of environmental barriers in housing, such as stairs to upper story with necessary dwelling functions, no handrails and projecting nosing open riser stairs, as you can see in the picture to the left. And Housing Enabler is a systematic structured observation of environmental barriers in the physical home environment. It has more than 25 years of development, research, and practical use in collaboration with stakeholders. And environmental barriers are defined in relation to building regulation in each country. And it's detailed and qualitative measures, and so far only used by professional trained raters. And the development or co-development involved several steps in a rigorous process that has been described in detail in Granboom 2033. You have a reference down here. And it was development of the descriptive data items. It was identification of core items from the Housing Enabler screening tool, reformulation and assessment items to yes and no questions. It was iterative design of the app, formulation of instructions, design of measurement illustrations, as you can see to the right, an iterative pilot process, and inter-rater reliability evaluation. And this was done together with different stakeholders, including older adults. And in this picture, you see a screenshot of the app on a smartphone, and it had 4 parts. The first part was about the housing, and the second part about the residents in the household, and the third part was the assessment of barriers, and the fourth part was about the assessor and how they made it. A website containing information about the purpose of the Citizen Science project, an instructional video for data collection, a detailed guide describing the project and the mobile app, and a database with an interactive interface was created for the housing experiment. And this, I described the website that has more than 12,000 visitors during a 15-month period when the project was active, and it was during the corona pandemic. And to the left, you can see screenshots. Maybe you cannot see here or read because it's too small, but the link leads to, and it's still active, so you can go there and do your analysis of this data material yourselves. And on this, you can, it's simultaneously and successive storing of data, and it's categorization according to postal area codes, and its possibility to run analysis online for different municipalities. And it's also possible to run accessibility problem analysis using functional type profiles for different complexity. In other words, utilize the data on barriers in combination with so-called type profiles of functional limitations to operationalize how housing accessibility problems are generated for population subgroups with different combination of functional impairments. And older adults were recruited via the 3 national senior citizens organizations, and the target was 3,000 or more. And Public and Science also has an established network of school teachers were used to reach pupils. And from September to November 2021, the mobile app was available to free download from publicly available platforms. And downloading and using the mobile app for 15 to 30 minutes, individual participants assessed and registered environmental barriers in their own home. And data on the national level that otherwise is hard for researchers to get access to, roughly equivalent to 400 hours of data collection. And when all questions were answered, the results were digitally submitted to the database. The data registered by the individual participants could be downloaded or printed, so they get an information about the accessibility in their own home. And now the evaluative study we had, it was an online pre and a post questionnaire to selected groups of possible participants. In other words, it was one questionnaire prior to and one after their participation in the housing experiment. And when it comes to the evaluative study, 147 participants answered the pre-questionnaire, but only 100 completed the housing experiment tasks, downloading the app, making assessments, and submitted the registered data and the post-questionnaires. And there are several insights regarding benefits and challenges related to user involvement in research on aging and health. The only attitudinal change was that significantly more participants rated the importance of housing accessibility lower after their involvement in the housing experiment compared to those rating it higher. And user involvement is not always beneficial for the users involved in terms of leading to new insights, changed attitudes, or improved skills. Such benefits are linked to how deeply involved the users are in a specific project. In the housing experiment, the participants were invited to contribute with data collection. In addition, it emerged that a prerequisite for older adults to be able to engage in citizen science projects that require the usage of smartphones or tablets is sufficient mobile digital literacy. There are indications that it is something that would need to be taken into greater consideration on a more general level in the conduct of this kind of research to reduce risks of unintentional exclusion of certain groups of users. And the evaluative study indicated that it's a challenge to involve older adults in research and citizen science projects. The descriptive study is based on 1,181 homes that were assessed, a much lower than expected response and completion rate. The few registered cases per municipality could not build valid data on housing accessibility, useful for national or local action and impact. However, the descriptive study gives indications on the character and magnitude of physical environmental barriers and accessibility problems as recorded by participants in different types of housing and residential area across Sweden. On average, there were 14 barriers in the homes of the total, actually it's 40 barriers in total investigated. And in apartments, the most common barrier was that support handles in the bath showers or the toilet seat were missing, 90%. And in single-family housings, the most common barrier was that there were steps that had to be passed to enter the home, 98%. And older homes had more barriers than newer homes. And the results of the descriptive study largely confirms what previous research has found, that the Swedish ordinary housing stock still contains substantial numbers of barriers, both in single-family houses and apartments, generating severe accessibility problems for many older adults. And it was more barriers in detached house, as you can see in this table. and there were no housing that has zero barriers. And the evaluative study confirms indications from previous studies that limitations in mobile digital literacy and functional ability affect the willingness and ability to get involved in research. The only attitudinal change was that significantly more participants rated the importance of housing accessibility lower after their involvement in the housing experiment compared to those rating it higher. However, this should be seen considering the predominantly positive attitudes before the housing experiment. In the post-questionnaire, only 5% of the participants reported that they had studied the results on the website. In other words, the web-based database for data display and tailored analysis was barely used by the older adults participating in the housing experiments. And despite repeated efforts, only 1,188 participants completed the housing experiment. We had expected 3,000 participants or more. And the knowledge that emerged from this study is useful for researchers and citizen science organizers because it highlights important aspects to take into account when designing similar citizen science projects. And it's also useful for policymakers and the wider society through its contribution to the understanding of what gains can be expected based on the efforts made. And further research is warranted to investigate how similar citizen science project or user involvement could be designed to attract more participants and to create the conditions for greater gains for the participants. A new idea for a local extension of the housing experiment to empower older adults to influence housing policies and local housing provision practices is we want to go. And then to increase the public awareness of housing accessibility and aging. Thank you for listening. And in the picture you can see a new built office for Medicum, our new workplace, and it's designed by Henning Larsen. And you are also welcome to Helsingborg in April 16th, when we have a conference in collaboration with the Lund University's thematic collaboration initiative, Social Right and Housing for the Aging Population. Thank you.
I thought that was a great project. Don't be discouraged that you didn't get as many respondents as you'd hoped for. It's really important to try. I really think it is. And also the fact that you maybe didn't get as many respondents teaches us something as well.
Yes, absolutely.
Did the app scare them? The mobile? What was it? What do you think?
Well, it was the app and the mobile. When people had downloaded it and used it, it was very. It worked well, but it was an issue to download an app and the information before. And we had plans also to have people participating with that, but when it was the corona pandemic, we could not do any more about that. So it was more the digital infrastructure that was the problem and not the app itself, because it worked well according to our evaluation. And also the results, you can see that it was few errors or missing results when it worked.
Well, that's important learning as well,
yes.
in and of itself.
Yes.
So thank you so much.
Yes, and if there are any municipalities here that want to join our project and be one of the local, I mean, Jönköping, for example, who had the ambition to be the best age-friendly city, you might join our project here if you want to know about housing accessibility in your municipality.
We might have some ideas so we can talk about later, yes.
Thanks.
Well, there you go. That's what we want. So not only do we have colleagues from WHO Europe with us, but we also have someone from WHO Global. It's my great pleasure to introduce Alana Officer, Unit Head, WHO, Demographic Change and Healthy Aging. You'll be talking about WHO Global Commission on Social Connection. The floor is yours.
Thank you, Anna-Berit. I love coming to age-friendly city and community conferences. I always learn so much, and I always feel really inspired by what's possible. So thank you for the invitation, and thank you for the privilege. So I'm going to talk to you about WHO's Commission on Social Connection. So I really want to talk about why the issue of social connection is actually important, why it should be a global priority. I know we're all looking for resources, but why more resources should be put in this particular topic. I want to talk to you a little bit about why we're going to do some more work in this area and what we're going to do, and also why the success of enhancing social connection is dependent on all of you and what you can also do through your work in age-friendly cities and communities and healthy cities. So, point to you. Hello. I feel a bit rude about that. Yeah. All right. So basically, I'm going to give you some definitions on what do we think of in terms of social connection. So social connection is really related to how close or connected you might feel with other people. So we know that, like most things, it's on a continuum, but it's made up of these structural, functional, and qualitative aspects which are really important. By structural, we think about the number and type of relationships and the associated roles. Are you a sister? Are you a spouse? Are you a neighbour? Are you a friend? And we talk about the qualitative aspects of social connection. So they relate to the types of support that you might get through those connections. Are you getting emotional support? Yeah? Are you getting information? Is it practical support that you're getting through those relationships? And the qualitative aspects also relate to whether those relationships are positive or they're negative. So do you get satisfaction from your relationships or not? Or are they conflictual? So this is all around what we're thinking when we're thinking of social connection. There are two other related and very key concepts, and that is loneliness and social isolation. And we think of these as deficits in social connection. So loneliness is that subjective feeling that you can have that arises from basically a mismatch from what you desire in terms of your social connection and what you actually have. And it relates to the functional, the structural and the qualitative aspects. Social isolation is different in the sense that it's really around the numbers, yeah? So we've talked about other things around quantitative and qualitative. Social isolation fundamentally is the objective number of social connections and interactions that you have as an individual. And it's very structural in the way that we look at it. So, back to my friend here. And there are really three main reasons why we think that social connection needs to be much higher up on the political agenda, but also in terms of global public health priority, and why we're stepping up the work. I like to think of them as the three S's, yeah? Scale of the problem, severity of its impact, and solutions. I'm going to talk a little bit about each of these. So the scale of the problem is based on the available data, and you'll see on this slide, and we've broken it down for social isolation in older adults and loneliness in adolescents. So you'll see on the purple chart that although the results differ slightly across regions in terms of older adults, the data or the prevalence is not lower in lower middle income countries and other regions than it is in sort of more Western regions of the world. So that's the first message, yeah? That this is an issue which affects people everywhere. If you look at the green chart, and I know we're talking predominantly here around older adults, but there's a lot of instances of work that benefits, as Anna Barrett said, that a lot of the age-friendly work is really about benefits for all ages. So we're looking in the work that we're doing on social isolation. We started with older people, and we recognized then when we looked at the prevalence that loneliness also in adolescence is a really big problem. The results that I'm showing you here are likely a real underestimation, but this is the only global data that we've got that's comparable for you to be able to see across the different WHO regions. But you'll see here that basically we've got between 5 and 15% of adolescents that experience some form of loneliness or social isolation. So in short, the issue is really widespread. It affects all regions of the world, and it affects people of all ages. So I talked about the severity. The lack of social connection, social isolation, and loneliness have really serious impacts on people's health and well-being. The consequences for which we have the best data is really around premature mortality. People more likely to die earlier than they would otherwise do because they lack those social connections. So people lacking social connection have an increased risk of dying earlier by about 26 to 33%. That's really high. We often think, we know that smoking is not good for our health. We know that not doing enough physical activity is not good for our health. We're aware that if we're overweight, that can impact on our health. We all are talking about air pollution, yeah? Lacking social connection has a greater or comparable impact to all these other risk factors. So, severity, yeah? And although we have less, well, actually, I might talk about the health outcomes first. So we know that it affects physical health really significantly. So high risk of stroke, high risk of cardiovascular disease, and we were talking about NCDs, so they're the link between the NCDs and social isolation and loneliness. Huge impact on mental health, increased risk of depression, anxiety, suicide, and up to a 50% increase of dementia as a result of not having those social connections. So we have less data on the non-health outcomes, but for instance, younger people who are lonely in high school are much more likely to drop out of university. We know that, for instance, feeling disconnected and unsupported within your work environment leads to poorer job satisfaction and lower performance. So we don't have that much evidence at the moment on the costs, but generally where we do have a study, for example, on loneliness in Spain, about 14 billion or up to 1.17% of annual GDP was found in terms of the costs or the impacts of loneliness on people of all ages within Spain. But this is where you're really important also, is that we know that poor social connections has an impact also on our communities and on our wider society. There's mounting evidence that whether a community, and you talked about this, Hele, in terms of whether a community feels safe, yeah? Whether it's prosperous, whether it is well governed, depends in large part, in fact, on the social connections within the neighbourhoods, within the workplace, and within our schools. And social connection through this concept of social capital has been shown to foster both socioeconomic development and also innovation within communities. So there's huge, not only public health, but broader development benefits. So taken together, the scale of the problem, the severity of the problem and its consequences, and the fact that it has really significant costs for us as individuals, but also for our communities and our society, but that it is an under-recognised issue, yeah, and that really insufficient work has been done on the topic until now. I always love topics where there's great potential for change. And when Yongjie was presenting, obviously the work on ageism, the work on creating age-friendly cities and communities, but here on social connection, we have so much potential for making a difference, yeah? So at WHO, and Yongjie presented it, we've been starting to map the evidence on interventions around social isolation and loneliness. And they're very broad, from societal to community to individual. And we've identified that there are literally hundreds of interventions that are being implemented and evaluated at the moment that are related to decreasing loneliness and social isolation across different age groups. Fascinatingly, most of it has happened in the last 5 years. Most of it is addressing this individual level and sort of interpersonal relationships, but there are many that are also being evaluated at community level. A great result, which is not always the case, is that a lot of these evaluations are in fact really good quality. Randomised control trials are very good quality, which means that we can have more confidence in the results of these studies. And it looks like many of the interventions that people have been implementing around the world actually work. So this is really exciting around our potential for change. Yeah, I wanted to talk about why now. I mean, there's a sense of why social isolation and loneliness, why now we're putting it sort of on the higher public policy agenda. So I think these have already been discussed, and I think that Dominique, you spoke to some of these earlier on. The idea of industrialisation that began sort of 200 years ago, basically, the spatial divisions that exist now within the way that we create our societies, huge changes in family structure, increases in geographic mobility which impact on social connection, both positively and potentially negatively, and really rapid technological change. More recent developments also in terms of we have much more science now on the impact of social isolation and loneliness and its severity, both prevalence and severity. We didn't really have that before. The advent of social media, both with its benefits and its disadvantages in terms of social connection, and the fact that now there are an increasing number of local and national initiatives that are being implemented to really tackle the issue, both in high-income countries, but also through the work that's happening in age-friendly cities and communities. All of us had the opportunity through the COVID pandemic to have a sense of what that means to be socially isolated, and that's really helped raise the profile of the topic, and also as a stimulus for WHO to take more action. So we have decided, so the Director General has decided to set up a global commission on social connection. So we hope to launch the commission very soon. It will have a 3-year time limit, and its main aims are to increase the priority, so political visibility and priority that's given to the issue of social connection, to reposition the issue so that we understand it as a global issue, not just a high-income country issue, which is predominantly how it's still perceived, to reposition it as not only an issue that affects older people, that also affects people, younger people and people of different age groups, and to really try and scale up solutions. So the main outcomes of the Commission, I'm saying this here and I'm presenting it to you before the Commissioners have had a chance to reflect on this, but we anticipate that one of the key outputs will be a report that will come from the Global Commission on Social Connection. And the intent there is that it will make the case for why further action needs to be invested in terms of building social connection by summarising the best available evidence that we have on the topic and really outlining how we can take this forward. It should identify the priorities and set the agenda for the next 10 years for WHO and for our partnerships on the topic of social connection. The remaining, so that we anticipate will come out in the first half of the Commission's mandate, and in the second part we anticipate that they will work predominantly on measuring. So we've talked a bit about this, but how do we understand what is the prevalence around the world and have comparable data? How do we know if what we're doing makes any difference whatsoever? And we spend so much investment on things that we don't know if they work. It's really important that we can have a look and understand whether what we're doing makes any difference. Also to identify those solutions for which there is good data on effectiveness and cost effective, and work with partners to scale those up. And we're really interested in the sort of broader advocacy and awareness raising, you know, whether it be through Netflix type documentary or other mechanisms whereby we can talk about the topic. In support of this work, the structure of the Commission and the working is threefold. So we will have between 12 and 14 high-level political leaders, thought leaders, advocates who are working on the topic, who will come together and drive and lead this agenda going forward. It will be their role really to reflect on how we can take this forward over the next 3 years. WHO will also have a technical advisory group, which for us is a really high-level group of the best experts that we can find from around the world, who will advise WHO on all of the technical aspects on social isolation and loneliness and social connectedness, from the measurement to the interventions, as well as how do you create awareness and generate more public awareness on the topic. So we'll be setting up a technical advisory group that will help us do that. And then you've got people like me who work in the Secretariat, and we have an amazing team of people, small but stars, who really will support the commissioners and the technical advisory group. So a really incredible opportunity, and I think an exciting one at this time. But it obviously has connections, and Yongjie spoke and showed you the film and talked to you about the decade. I'm not going to go back on to that, but just to say that obviously within the UN decade of healthy aging and other initiatives in WHO, there are really strong connections with the work we're going to do on social connection. So living long and healthy lives, a sort of a prerequisite for that is also around social connection and the importance of supporting that. So, sorry, I haven't got used to this. So, you know, Yongjie spoke to the fact that we've got the decade. It really is intended as a framework for doing things differently. We've got 4 action areas, 4 enablers with older people at the centre. You probably, many of you knew about the decade, but just a reminder of those action areas are changing how we think, feel and act towards age and ageing, ensuring that communities foster the abilities of older people, delivering integrated care and primary health services that are responsive to the needs of older people, and providing access to long-term care for people who need it. And in the decade, we also work on a lot of what we call cross-cutting issues. For example, the abuse of older people, or social isolation and loneliness. And these issues are issues that are identified because you cannot just intervene in one action area if you want to generate change. So to address social isolation and loneliness, you need to change how people think about age and aging, both younger and older people, but also their perceptions around social isolation and loneliness. You need to challenge stigma around that. You need to ensure that our communities can foster social connectedness. We've talked about the intersection also between health and long-term care and social connection as well. So I just want to talk maybe briefly about the global campaign to combat ageism and the work of the network, and just making those connections. So the first action area is changing how we think, feel, and act. The way that WHO, in terms of our role on the UN decade, so we lead and coordinate across 22 UN agencies, the work around the UN decade, but our role is really in addressing the first action area. We do that through the global campaign to combat ageism. Yongjie spoke to the global report on ageism, which set out the best available evidence, and it found that ageism shortens lives, leads to poorer physical and mental health, worse health behaviours, i.e. less physical activity, more likely to smoke and drink, poorer mental health, but importantly also, just making the connection, exacerbates social isolation and loneliness. In terms of the strategies, one of the strategies that we know work, so there's 3: policy and law, education and intergenerational contact interventions. We know that intergenerational contact has been effective at reducing social isolation and loneliness, yeah? So we've got strategies within each of these different action areas that can reduce the problem. I don't really need to talk to you about the Global Network for Age-Friendly Cities and Communities, but that's our vehicle for also addressing the second action area within the decade in creating communities that foster the abilities of older people. As you all know, our environments are all the factors, the attitudes of people, the service providers, our physical infrastructure, housing, etc., that make up our lives. And we know that age-friendly environments can enable older people to do what they value. Developing age-friendly cities and communities are in fact a proven strategy for creating environments that are much more age-inclusive. And we know that age-friendly cities and communities are one of the strategies that can help reduce loneliness and social isolation, particularly in older age. We don't actually have very much evidence around it in terms of its impact on younger ages. But generally, age-friendly environments are absolutely key to creating social connection. And really, I guess I wanted to make the point is that you're already doing it. So I went back before coming here and looked at Age Friendly World and looked at the database of age-friendly practices and started to see that there are already a number of really exciting examples of for example, in Toronto, how they're trying to reduce social isolation and loneliness within long-term care institutions, yeah? That in New Zealand, they're really trying to work there on reminding older people within those communities around the different activities that exist, how they can benefit and how they can access them, so making those connections. I love the chatty benches for spontaneous conversations in Gothenburg in Sweden. Some really many examples of how technology is being used to reduce social isolation, improve digital literacy, and reduce social isolation and loneliness in older adults in many communities around the world. And some really great examples also, for example, in Manchester, with these great tips and advice on how you can keep active and keep connected. This was a big focus on winter and also during COVID, is as another example of age-friendly practices. I hope that over the period of the Commission on Social Connection, we will see a lot more age-friendly city and community practices being made available. So I think maybe just as a final message, it's really, I know you're already involved, but there is other opportunities to stay involved and stay connected. If you're an expert on social isolation and loneliness, on social connectedness in any way, we are in the process now of setting up this technical advisory group. I would encourage you to apply, and we can maybe through Yongjie share that call for experts. If you want to keep abreast of the work that we're doing on the Commission on Social Connection, I'm sure you're all signed up to Age Friendly World. If you're not, please do. But you can also sign up to the UN Decade for Healthy Aging. You can sign up to the Global Campaign to Combat Ageism. And if you haven't seen it, there's a new site for the Global Campaign to Combat Ageism. We need more examples. I was excited by the examples I saw on the age-friendly practice database, but they weren't enough. Yeah. So I know you're doing amazing work. So if you are, please share that so that other people can benefit. And we do have one advocacy brief, which Yongjie spoke to, and the evidence and gap maps. If they're useful to you, please share those as well, so that you might, other people can also benefit. Thank you very much.
Healthy chocolate for you as well.
Oh, so I get it. I might share it with my colleague here.
Yeah. No for him. Thank you so much. We do actually have time for some reflections and questions, either maybe to Oscar or Lana, if there are any. It's been a long day for a lot of you traveling since early morning, but let's see if there's some energy left.
Okay, so a question for Lana. Yes. Yeah? Okay, so you showed a slide with, you said there are many effective interventions out there. Sorry, can't look at you. But
yes?
Yeah, much better, thank you. So many effective interventions targeting social connectedness. But could you say something about, or do you know what types of interventions seem to be the most effective? So, for example, are they the educational interventions or interventions, cultural, sharing, read sharing or something? Could you say something about that?
It's a great question. So you would have seen that we've been developing these maps. So they're evidence and gap maps, which bring together all of the available evidence, and it just maps out what exists. Yeah. So I've got two answers to your question. One is that at the moment we haven't actually, which is what the Commission will do, or we will support the Commission to do, we haven't yet analysed all of that evidence to know which are the best buys. So that's something that we need to do. That said, I can tell you that at the moment, the evidence that we have on effectiveness, which is really strong evidence, is mainly around individual level psychological interventions like cognitive behavioural therapy, etc. So that's a bit of it. But we think that there are many other interventions that will be effective in reducing social isolation and loneliness, but we haven't yet done that work to really pull those out.
Don't go just yet. Yes, there are others. Yeah. Oh, you were first. Sorry, I didn't see you there.
Is it on? Yes, I have a question to Lana as well. I'm interested about the objectives in terms of to reduce loneliness and social isolation, and how much these are integrated into the work of regional WHO offices. For example, at the moment, the Regional Office for Europe, in collaboration with European Commission, they are working to develop a national long-term care system assessment instrument for Lithuania, to be piloted in Lithuania, but also in other countries. So in that context, I'm interested how much aspect of social isolation and loneliness would be taken into account, if you are any aware about this. Thank you.
Yeah, it's a great question. I would hope that by the DG setting up the Commission on Social Connection, because it hasn't been launched yet, that will also, and obviously this is supported by all of the regional offices. We've engaged quite extensively with experts and WHO at all levels, so country, region and headquarters, that it will create the opportunity for integrating issues around social isolation and loneliness in exactly the opportunity that you're talking about. It's not happening now, yeah, but it can happen through making those connections. And maybe the fact that you've raised the issue now, I'm going to pass that back to Yongjie, yeah? He can make that happen.
I'm asking because in 2 weeks I'm invited to a meeting with actually a colleague from the regional office to talk about that, how this tool should be developed. So I was interested in if,
Yeah. Then maybe you can be the stimulus and catalyst
maybe,
for change.
Maybe. Well, I'm not sure at which stage they are in the moment. I mean, in this, which stages of this toolkit development? Maybe they're already kind of ready to pilot. But thank you for sharing what you think.
I think Thorhildur was first, and then Kenny.
Yes, I want to thank you very much for this interesting presentation. I felt like I was coming home. I've been waiting for 40 years for a presentation like this, because social health is so important. Yeah. And tomorrow I'm going to give an example from Reykjavik, and I think it's so much to learn, so much to go with further, to develop this kind of how we can build social capital, how we can help the older people themselves to do things they want to do, and through activities and through giving them opportunities to influence the society, and it's so important to walk the walk with them. So this fits into all the boxes I really like, and I'm so happy to have you here and to do this. I kind of get it straight from the horse's mouth, I guess. So thank you very much.
Thank you. No, I'm very excited to hear you say that, yeah, and the fact that it resonates with you. I think, I hope it does with many others as well, and that through that we can create a movement really, and together create change. Thanks.
I think there was another one.
Kenny.
Yep.
Yes, and this is perhaps a question or a request for both Oscar and Alana to reflect on, and it's about measuring, assessment, and engagement. And to my knowledge and to my what I have seen from my perspective and what I know is that, for example, the rate of people answering national surveys is going down in Sweden. I suppose it's perhaps a general trend, maybe. Also that we often want people to engage, and we want to know, and we want them to be part of different projects that we have to know more and to learn. And there's sometimes a fatigue from people. Please join us, please be part of this and that. And then we don't connect back, and we sort of, people get this fatigue. And also a third aspect of this is something I heard just recently, a professor researching the collaboration of governance and network collaboration between public authorities and municipalities and the civil society, who said that oftentimes when we try to assess or measure the results of that kind of interaction, if we follow up on what we wanted to measure, it might be, this went so-so. But then there are a lot of good things happening in the subtleties on the side that, okay, so what did we measure? And even if it was not a good result from what we measured, but there happened a lot of things on the sides that we also need to include in the measurement. So different challenges regarding involvement and measurement for the future, so to speak. Measurement, it's really important, of course. It's part of the knowledge and the iteration and everything. But what do you see in the future is, do we need to approach the area of measurement differently than we are used to or was used to when people were more ready to engage and to answer questions from authorities, so to speak. Thanks.
Do you want to start? Are you yeah,
Okay, thank you for the question. Yeah, that is right. It's very hard to get high answer rates on questionnaires, for example. And that's an issue because this fatigue, because you are in front of a questionnaire if you buy something on the internet, or it's a lot of questions. And also I was mentioning this in when we did this evaluation study, it was 147 that answered the pre-questionnaires. And then we also had reminders to those who participated in that, but we only reached 100 of them. So it was a lot of loss there because different reasons. But I mean, that's what you have to count for, and it's important to which groups we reach, because mainly in our case the participants were highly educated. And that might also have an impact on the measurements they give us. So absolutely, it's an important issue. So we might have to change approaches to really target those people that we want to include in studies. And also from a researcher perspective, it's also the ethical issues that are can be a barrier for us. For example, in another study, we had intention to have 1-page information, but then it turned out to be 4-page information, and that's very hard for. Then we get low rates, and we cannot use the terms that you use in marketing, because we are only asking for people to volunteer in our studies, and we cannot. So that's an important issue.
I mean, it's a great question. I think we need to do surveys, but we need to think about when we're doing them. We need to make sure that people have the capacity to engage. I think we need to make sure that we're giving back. So what we're getting, I know you did that, but people they need to feel that their voice has been heard and that they can see that. But I think a really key thing for me is around meaningful engagement. People are interested to put their voice if they think it's either going to make some sort of change, or it's going to benefit them in some way. So if it's just extracted information for which they don't see the value in it, then people are less likely to want to engage. We know that, in fact, these sort of housing assessments, when done with professionals and that they get some benefit from it, there is much stronger engagement, in terms of that process, So I think the sense that older people need to be meaningfully engaged, and that means that when they give their opinion, it has some impact on the decisions that are taken that actually impact and affect their lives. So I think that we can do a lot more around asking the questions to people and supporting them to be able to answer, but also reaching really diverse communities, because we've talked a lot about the sense that are we actually reaching all of the people whose opinions matter and whose voices we need to hear, and then making sure that that information is used and then there is some benefits as a result of the support that they're providing through their opinion.
Thank you. I have 2 questions, one for Oscar. Thank you for the presentation. In Denmark, we have recently done some studies about the feeling of, I don't know how to say it in English, but maybe the feeling of feeling home where you're living, while either you're living at your own home or at a nursing home. So I was just wondering, your app, could that maybe also assess, like the subjective feeling of home, like the objective, if you can say, that feeling of could be able to access different things? Just question, because to us that's really something very important. And we see, and that brings me over to the next question about feeling you belong to a place, or feeling connected to a place or to other people. So when you talk about, that's for you, Alana, thank you for your presentation, the feeling of social connection, one thing is the social relations, but also maybe belonging to the place or the city. Is that also an aspect of when you talk about different indicators and so on? So, mutual questions.
Yes, of course, it could be developed in other dimensions, but as we determine accessibility, it's the relationship between a person and with functional limitations, and it's the barrier in the environment. And a person, it's just a fragment of a person, it's just a fragment of the environment. But when we do that, we can measure it objectively, and we can also calculate it on it and see the severity of accessibility problems from an objective perspective. So I think you need other methods to measure feeling of home, for example. I think it's better to develop a language to talk about such issues instead of measuring it.
They're distinct concepts. So I think in terms of belonging, a sense of belonging and a sense of social connection. So social connection is often something which is also part of belonging, but they're not necessarily the same issues or the same concepts. So you could feel like you belong in a place, but not necessarily be socially connected, yeah? And you can be socially connected and not feel that you belong. Yeah, in the same way, because it's got different attributes to it. So they are definitely interlinked, but they're not the same concepts. Yeah, we would hope that through social connection and building social connection, that generates and increases the sense that you might have of belonging, because you feel part of your community, part of something bigger. And you know, in terms of your social capital. So we anticipate that will support a sense of belonging, but it's not sufficient in that sense.
Any others? Yes, Dominic?
Yes, thank you for your interesting presentations. I have an expert for you that I'm going to recommend, but my question is actually for Oskar. I'm not sure if it's only me who has not quite understood it, or if you didn't elaborate on it, but I wonder, the mapping that you did through the app, was it on just the sheer existence of these kinds of accessibility barriers or like spatial provisions, or was it also evaluating on the perceived lack of support, for instance? So when you are measuring that your lack, for instance, support in the bathroom, is that just the measurement or like the mapping of if that installation is physically there or not, or if it's perceived as something that is needed or lacking for that environment to feel accessible? Does my question make sense?
Yes, and it was not the perceived, it was the actual physical, if it was a handle or not. So, and it was very detailed in the instruction and the measurement with the centimeters and we had. And in the full instrument, there are other items that you more have to make an evaluation of, but we reduced that in this because it should be simple and clear what to measure.